So single tooth dental implants, especially I guess where they show, can you match them up? And is that a routine procedure for you?
It's actually really tricky to make an implant. You can do it, but it's something that has to be done carefully.
Okay.
You know, there's a lot of different factors that affect light and gingival contour that make matching an implant, say if you want to compare right front center, it's tricky to do, but it's doable. But you know, what are your choices basically? Your choice is a bridge where you would have to cut down 2 good teeth. And typically in a single tooth scenario where there's been no other disease or problem, you're usually talking about fairly young, kind of even say as young as 19 or 20 where you have congenitally missing teeth, or someone kind of, you know, mid 30s, 40s where they've, you know, been skiing and, you know, bonked a tooth out. So in those cases you don't want to damage other teeth because they're basically pretty healthy. So instead of cutting teeth down, doing a bridge, we do an implant. You know, if you did crowns on teeth, you'd have recessions and margin.
And those are strong. I mean, how long can an implant last? I mean, ideally, what are they supposed to?
Well, let's say the 10-year.
front.
Yeah, the 10-year numbers are going to be single tooth, say 95 to 97%. You know, our own data right now, single tooth scenarios about 98%. And then into say,
but definitely longer than a bridge.
25 years. I would say well over 90% would still be there.
But much longer than a bridge would be.
Well, you know.
Statistically.
Statistically, probably yes. But more importantly, too, is what happens when the bridge fails. You know, say that you did do the bridge and 15 years later there's a problem with it. Now you've got 2 teeth that are a problem, you know, and then you might take that and convert it to a 3 teeth or a 4 tooth problem. So the problem tends to grow. And that's what we see is, you know, so someone now in their 50s and 60s or even 70s is dealing with bridge failures. And now it's not just a few teeth, it's, you know, 4 or 5 in a row. And that's where, you know, implants certainly make a lot of sense. But even avoiding that beginning in the very start is with a single tooth.
So what do you say to parents, maybe it's a college student, has an accident of some sort, or they have some sort of a flipper or something going on.
Yeah.
What's your message to them about why they'd maybe want to convert to a dental implant?
Oh, as opposed to wearing a partial forever?
Yeah.
For one thing, I don't think I'd want to wear a partial forever. If you've worn one, you would appreciate that nobody likes them. But the other problem is the bone will atrophy over time. So if you want to wait and put it off, you know, a couple of years maybe is not so much of an issue, but you know, 5, 10, 20 years later, that bone will be gone basically. And then, so it makes more sense to treat at a reasonable timeline, you know, and that means within, say, a year of the tooth loss would be the best case scenario. The limitation there is age. You know, 18 or 19 is kind of the earliest we like to start because there's still growth. The difference with implants and teeth is that teeth move and erupt and implants don't. So somewhere down the road, 10 years later, maybe the height of the tooth might be a bit different because there's been some eruption changes. And to avoid that problem, you want to be at least kind of into the 19 years or so.